It's Health Tidbits with Dr. Kohli. I'm Jenny D, and of course, Dr. Kohli from 9 News and her practice, Cherry Creek Heart in Aurora. Thank you for stopping by. We are wanting to talk about these new cholesterol guidelines, and they're completely changing the rules, which for cardiologists, for you, that's got to be fascinating to see how this has all come to be.
I am so excited, Jenny, and we had our big heart meeting a couple weeks ago. It was literally standing room only. There was a bouncer at the door. Everybody is just so excited about these guidelines. So they have done a complete 180 on everything.
Okay.
And so essentially, we've been aggressive about cholesterol for quite some time. We know that cholesterol causes heart disease. But what these guidelines have done is said shift it earlier into our lives. Mm-hmm. So the idea of waiting till you have a heart attack in your 50s, 60s, or 70s and then reacting and doing something was a bit backwards. Really what we want to do, knowing that it's the most common thing that's going to happen to any of us, is start to treat it earlier in your 30s and 40s when that cholesterol deposits are starting to form inside your arteries, so that you never end up having that heart attack, that stroke, that dementia, or any of those other vascular problems later in life. So the guidelines, I think, have really made us think about prevention in a whole different way and really empowered me to know that I can prevent more heart attacks than I've ever done before.
And how is this affecting the way that we even think about heart disease risk and all of that in general?
So we have actually changed what we consider to be heart disease risk. So before we used to put your numbers into a calculator. Mm-hmm. We used a calculator called pooled cohort. Now we're using a different calculator called the prevent calculator. And, if you want, you can even kind of calculate this for yourself. It puts into account your zip code to account for socioeconomic differences. It puts into account your age, obviously your cholesterol, your blood pressure, all of these different factors. And it calculates your risk of having a heart attack or stroke in the next 10 years. And then it calculates it for the rest of your life. But now what we've said is let's change those risk thresholds. So not only are we using a more sensitive calculator, we've now changed those risk thresholds to actually say, okay, even this risk category needs to be treated earlier, because even that is potentially someone who's going to go on to have a high lifetime risk. So it's not just about your next 10 years because, you're in your 40s. Your risk of heart attack in the next 10 years is pretty low because you're young, right? But in the course of your life, your risk is quite high.
Yeah.
And so that's really what we need to start thinking about, lifetime risk rather than just 10-year risk.
And just start getting ahead of it and going earlier so that whatever those factors are that might be included in it, we can kind of get a little head start instead of, like you said, afterwards going,
so now
we're doing triage. No, we'd rather do the prep first.
Right. So now we're starting to treat people in their 30s. So the guidelines now tell us, starting at age 30, if your cholesterol is high, because it's what's called cholesterol years of exposure. It's not just how high your cholesterol is, but how long it's had time to get stuck inside your arteries, right? So it's kind of a novel concept because we used to be afraid to give cholesterol medication, statins, to people in their 30s because we're like, no, they're in their growth phase and they might be having, babies if they're women. And so we don't want to mess with that. Now it's a different mindset. No, we start them in their 30s if their cholesterol is high enough. So if your LDL, which is your bad cholesterol, is over 160 in your 30s, we'll start treating you. If it's not over 160, we'll start treating you in your 40s.
Okay.
So a lot of my patients now are coming in just to get cholesterol checked and get on cholesterol medication in their 30s and 40s.
And that's a huge thing, especially in our family. We've got a lot of that, heart risk.
Do you know your bad cholesterol?
So no.
But you will after this.
I was going to say, after this. Now I have always a list whenever we're done talking of the things that I want to ask my doctor. Be like, hey, so should I be checking this?
Yeah.
And actually, and it's great to know that because I think sometimes we're so busy taking care of everyone else that we forget, you have to take care of yourself as well or you won't be there to help.
Well, and here's the problem with cholesterol. No one comes in saying my cholesterol hurts.
Yeah.
Right? It doesn't cause symptoms, but yet it's going to help you age better. It's going to reduce your risk for heart attacks, for strokes, for dementia, for men, for erectile dysfunction related to blood vessels. I mean, so many different things you can actually help our bodies age better because every organ in our body has blood vessels.
Yeah.
So if you keep the blood vessels healthy, are you really going to make it so that people live not just longer, but live better?
Live better.
Yeah.
And I mean, we talk about bad cholesterol, of course, because it's bad, but that's not the whole story. So are there other tests that when we go to our physical, in addition to regular cholesterol ones, are there other tests that we should be asking for and advocating for?
Yes, for sure. So there's a bunch of blood tests. So LDL is that bad cholesterol that usually is checked as part of your annual physical. You want to ask for a test called ApoB. Okay.
Okay.
Apolipoprotein B, especially for somebody who has extra weight on you, you're diabetic, you have a little extra weight, especially around the tummy, you have high triglycerides. That's the other bad cholesterol particles in your
Okay.
bloodstream. And then you want to check for a genetic marker, which, by the way, 20% of us have elevated. It has nothing to do with your weight. It has nothing to do with how you look or how you exercise or how you eat. It's called lipoprotein A. 20% of us are elevated in this, and this is 6 times as poisonous to the arteries as the bad cholesterol. And up until a few years ago, we didn't even know we were supposed to check it, so we call it the stealth cholesterol because it's hidden, right? Your regular cholesterol can come out looking okay, and this marker is still elevated. So now I'm checking this once on every patient who walks through the door of my office, whether it's for palpitations or swelling in the legs or shortness of breath. I don't care why you're there. You're getting a lipoprotein A. So that's one test you need just once in your lifetime, but it's important to make sure you get it checked. And if you're worried about insurance or you don't have insurance, you can get it for free on a foundation website called familyheart.org.
Okay.
They'll send you a kit to your house. It's just a little
Pinprick?
finger prick, and you can send it back. And I would suggest you do this for yourself and even for your daughters.
Yeah.
Yeah.
I like that.
Yeah.
So also make sure you're regularly getting to the doctor.
Yes.
If you haven't had a doctor visit in a while, check out Dr. Kohli. It's Cherry Creek Heart in Aurora, and just be your own advocate.